D.Y. Patil institution. I think he is not there. I request Richard to come to the podium and brief us on the topic. Kindly introduce yourself also.
Well, thanks very much for this opportunity to come to India and take part in what looks to be a fantastic conference. My name's Richard Cockle. I'm the project director from the GSMA. I'll give you a bit more detail about who the GSMA are in a few moments. But I'm running a project which is focusing on mobile health and how do we develop mobile health as an opportunity to become a channel for the delivery of healthcare. So first of all, who are the GSMA? The GSMA are the global industry body that represents mobile phone operators worldwide. Every mobile operator in the world is actually a member, so we've got over 800 members. We're across 229 countries, and there's already over 5 billion subscribers worldwide. The aim of the association is to innovate, incubate, and help to deliver new opportunities where mobile can be a platform for its delivery. So, why is it important for us to come to India, and why were we so excited about the opportunity to take part here? Well, in terms of mobility is becoming ubiquitous across the world. Currently here in India, you're the second largest mobile market with almost 9 million subscribers, and we're going to continue to see that grow. Currently, I believe market penetration is around 75%, but by 2014, that's likely to reach 96% of the population will be within range of a mobile device. And we're also starting to see trends where smartphones and more capable devices are actually becoming available within the Indian market, and that will continue to grow with the rollout of smartphones. And why is smartphones important? Smartphones give the computing capability in the hands to really look to deliver some innovative solutions in terms of mobile health solutions. But it's not only in scale and size in terms of number of mobile connections that India is important. In a recent GSMA piece of work, we did some analysis of the market, or this developing market around mobile health. And we were actually really surprised to see mobile health is here. And if you look across the world, there's millions of actual applications where it's being deployed as a trial and where it's being deployed in commercial settings. And within the Asia-Pac region, you'll see that from the analysis which we've done, and I'm sure we haven't caught every single trial that there is, India is actually leading the field in terms of within the Asia-Pac region. So just a little bit of background about the GSMA program. We're running a program which is a global initiative looking at mobile health. So we're trying to look at what the global issues are, so that we can address those, and then hopefully those will have a ripple down effect into each market around the world. So the program's actually made up of 2 projects. We've got a project which is called Embedded Mobile Health, which is looking at global engagement, which is talking to the likes of the FDA and the EU and talking about regulation, and talking about talking with global standards organisations to attempt to standardise the way that healthcare can be delivered through mobile. And by that I mean purely from a technical sense, not from a healthcare delivery point of view. And then then a more interactive and more lower level engagement, we've got the GSMA Development Fund, who are actually looking to work with countries on the deployment of mobile health solutions and help to advise and give them support where we can. Some of the activities that we've had today, we've really raised the focus of mobile health within some of the conferences that we run, and Professor Ganapathy has been a very valuable contributor to that work and helping us and bringing the medical view to the telecoms industry. because it's very important that one of the main users for this this kind of technology will be the doctors that are in the field, and it's really important to make sure that we understand their requirements and make sure that the right solutions are being delivered. So that's why it's really important to get to come along to healthcare events like this and hear about what are the requirements going forward. In terms of the objectives of the programme, we're really trying to catalyse cross-industry awareness of mobile health. We're trying to demonstrate the outcomes for individuals, healthcare systems and society that using mobile as a channel to deliver healthcare solutions will bring. We want to foster new relationships, so that's why we're very excited to be here, and one of our major partners that we work a lot with, Continual Health Alliance, are also out and out in the area where the stands are. And I believe that they've got a workshop tomorrow which will be really focusing on how can we get to a utopia where healthcare devices, where the technology element of delivering healthcare disappears because all of the healthcare devices are standardised and they work and they're just plug and play. And then we can really focus on the important part, which is looking after the patient. And then we're also, and it kind of is aligned with that, is looking to push for interoperability and standardisation so that we can build scalable and replicable solutions so that they become easy to roll out, and it's all about the delivery of the care. And then we want to promote a supportive policy and regulation framework which is developed within the mHealth space so that it can support the rollout of these kinds of technologies. So just very quickly, that's what the programme looks like. We've got a number of different work streams which range from everything from technology, policy and regulation and strategy and markets, and I'll touch on those in a bit more detail. So recently, and is available for everybody to download, the GSMA produced a report which looked at what does regulation look like for mobile health. I think the first thing it identified was that there are actually two very different paradigms. The language that the two groups use are fundamentally very different, and the regulators are all very different. From healthcare, which is a very patient-centric focus, all about safety first, about demonstrating efficacy, and it should do no harm. Whereas the telecoms industry and telecoms regulations are all about making it market-centric and promoting competition, maximising value to customers, and do just enough to get it to deliver and become available in the market. So we've realised that we need to do a lot of work in bringing these two worlds together to help them understand each other, and then also to help ensure that the right regulatory frameworks are being introduced to support mobile health. Oh, something's happened. So unfortunately it's not very clear on here, but this was a simple end-to-end of a mobile health solution. And what we identified is that there was over 10 different areas where regulation actually touched such a solution. And those we identified as areas where we need to work together as a combined organisation or group or ecosystem to really look at these topics, understand them from both points of view, and then ensure that the right solutions are being put in place by regulators. So as you can't see them, just to pick a few up, so we've got a device regulation piece which is towards the far left of that slide, and that's a lot of, you may have heard a lot of stuff around the FDA and the recent announcement around the recommendations around apps, and we're actively engaged in there and ensuring that the appropriate regulation is being applied to those areas. And then the regulation ranges everything from the privacy and security, as our previous speaker mentioned, and ensuring that the patient's data is safe, all the way through to the regulation of the person using the device, if they're making clinical decisions based upon the readings from those devices, are they going to be secure? And what we're realising is that where mobile has come from a regulatory area which is very much about a component approach, in healthcare it's generally regulated from a system level. So not only have you got you've got to look for regulation all the way through the chain, there'll be the whole end-to-end piece which needs to be understood. So in terms of the themes which came out from the report, we identified 3 key areas, 4 even, I should say. So the first one is about patient empowerment and about giving the patient an opportunity to access this kind of care. It's about, we'll be asking regulators to create a framework that will enable users to take control of their own health in the way that they actually apply it. In terms of reimbursement, I think what's really important, this is a new way of delivering healthcare, and we must ensure that the right reimbursement models are there to enable this care to be offered, because obviously there's certain approaches which are used within this area that we don't want to limit the ability of mobile being delivered through healthcare due to there not being a way to get reimbursed. In terms of devices, it's about promoting clarity on what do we mean by device regulation. What does it mean about intended use, and what impacts could that have on whether a device becomes a medical device? And then systems and standards. So we would like to focus, or would like to see if it's possible to create a modular approach to the regulation of these healthcare systems, so that we can really give patients, doctors, the healthcare community as much choice as possible in terms of the devices, in terms of the solutions that they use, so they find the right healthcare mechanism for the treatment that needs to be given, rather than being limited by what is approved from an end-to-end perspective. So those are the key themes which we're working on. That report is openly available on the internet, and I'll give you the link for it in a few moments. The next piece of work in specific